Good evening, guys. I have your bonus one tonight. The bonus one explains plantar fasciitis and prevention explained. Okay, it's discussion E for y'all. All right, let me sit back here. Get my gear back on for y'all. Okay. The article revolves around plantar fasciitis, a frequently occurring cause of heel pain, especially among runners and walkers. It explains that this condition stems from inflammation in the plantar fascia, a thick band of tissue supporting your foot's arch. Repeated strain, like sudden increases in physical activity or poor footwear, can lead to micro tears, resulting in persistent stabbing. Heel pain, often felt during the first steps of the morning or after long rest periods. Risk factors include sudden weight gain or prolonged standing, flat feet or high arches, wearing shoes with poor arch supports. Aging related weakening of foot muscles. Why stretches matter. The surrounding page emphasizes prevention through stretching. These 10 exercises target calf flexibility, foot strength, and fascia elasticity, aiming to reduce tension and improve circulation in the affected areas. They range from tennis ball rolls, toe curls, and scoots, calf wall stretches, and tower pulls. Doing these consistently, especially before getting out of bed or after long sedentary periods, can both relieve existing pain and reduce the likelihood of developing plantar fasciitis in first place. If you'd like a breakdown of these 10 stretches or guidance on adapting them to particular foot structure or walking style, I can walk you through it. Pun fully intended. Long-term effects of plantar fasciitis. If left untreated or poorly managed, plantar fasciitis can evolve from a nagging heel pain into a cascade of chronic complications. Here's what the research and clinical insights reveal. Chronic pain and reduced mobility. Persistent heel pain can interfere with walking, standing, or even sleeping. Pain may become more intense and widespread, affecting the arch and ball of the foot, altered gait, and biomechanics. To avoid pain, people often change how they walk, leading to knee, hip, and back pain due to misalignment, increased risk of repetitive stress injuries, structural complications, heel spurs, calcium deposits from sharp protrusions that dig into the heel pad, plantar fascia tears or rupture. Micro tears can accumulate, and in severe cases, the fascia may rupture. Often accompanied by a loud pop and intense pain. Plantar fibrosis, fibromatosis, begin nodules may develop alongside the fascia, making walking painful. Lifestyle impact. Reduced physical activity due to pain can lead to weight gain, decreased cardiovascular health, muscle weakening, and stiffness. Psychological toll. Chronic pain conditions like plantar fasciitis can contribute to stress, frustration, and reduced quality of life. Especially when mobility is compromised. Increased risk of surgery. Long-term cases may require surgical interventions, which carries its own risks and recovery challenges. If you're curious about how these outcomes might vary based on age, foot structure, or activity level, I'd be happy to explore that with you, or we can delve into the most effective long-term management strategies to keep your feet happy and pain-free. Best long-term management strategies for plantar fasciitis. Managing plantar fasciitis over the long haul means more than just treating pain. It's about preventing reoccurrence and restoring optimal foot mechanics. Here's a comprehensive breakdown based on clinical insights and expert recommendations. Footwear and orthotics. Supportive shoes with proper arch support and cushioning reduces strain on the plantar fascia. Custom over-the-counter orthotics help correct biomechanics and imbalances and redistribute pressure. Avoid walking barefoot on hard surfaces or wearing worn-out shoes. Stretching and strengthening. Daily stretching of the plantar fascia, Achilles tendon, and calf muscles improve flexibility and reduces tension. Strengthening exercises like toe curls, marble pickups, and heel raises enhance foot stability and arch support. Balance training, standing on one foot, improves proprioception and reduces injury risk. Pain and inflammation control. Ice therapy, 15 to 20 minutes several times daily, helps reduce inflammation. Massage techniques using a tennis ball or frozen water bottle improve circulation and fascia mobility. NSAIDs. Ibuprofen may be used short-term under medical guidance. Night splints and activity modification. Night splints keep the foot dorsiflected overnight, preventing morning stiffness. Modify activities to avoid prolonged standing or high impact movements until symptoms improve. Physical therapy. Personalized programs address gait issue, muscle imbalance, and flexibility defects. Manual therapy, myofascia release, and joint mobilization can relieve pain and improve mobility. Education on proper foot care and gradual return to activity is key. Weight management and systematic health. Maintaining a healthy weight reduces load on the plantar fascia. Addressing upstream biochemical issues, hips, pelvis, lower back can prevent uh, compensatory strain on the feet. Would you like a tailored plan based on specific foot structure? Alternative treatment for plantar fasciitis. Beyond conventional stretching, and orthotics, a range of alternative therapies can offer relief and even accelerate healing, especially for chronic, stubborn cases. Here's a created list of options that blend natural remedies, regenerative medicine, and non-invasive technologies. Okay, natural and home-based remedies. Essential oils. Lavender or peppermint oils have anti-inflammatory properties. Massage oil into the arch. Use in a warm foot soak. Epsom salt soaks. Magnesium-rich soaks may reduce inflammation and promote relaxation. Massage therapy. Manual or ball-based massage improves circulation and fascia mobility. Ice therapy. Rolling a frozen bottle of water under the foot or applying ice packs helps reduce swelling. Physical and lifestyle interventions. Yoga and Pilates. These improve flexibility and strengthen foot and calf muscles, reducing strain on the fascia. Weight management, reducing excess weight, lowers mechanical stress on the plantar fascia. Footwear modifications, switching to shoes with proper arch supports and cushioning is essential. Repetitive and non-invasive therapies. Regenerative and non-invasive therapies. Shockwave therapy uses acoustic waves to stimulate healing and break down damaged tissue, shown to be effective for chronic cases. Platelet-rich plasma injections, concentrated platelets from your own blood into the fascia to promote tissue regeneration. Prolongotherapy involves injecting dextrose into simulate healing and reduce inflammation. Stem cell therapy, bone marrow, or fat derived stem cells may help regenerate damaged fascia. Other non-surgical options. Night splints. Keep your foot flexed overnight to prevent morning pain. TENS therapy, electrical stimulation to reduce pain and improve circulation. Custom orthotics or taping redistributes pressure and support foot mechanics. Would you like help comparing these based on cost, accessibility, or stability for aging challenges? I can also explore how these align with memory-friendly housing or smart therapeutic innovations right up your alley. Cures or activity levels, or we could explore how these strategies adapt for aging. Populations or those with cognitive or mobility challenges. Areas you've gotten keen eye for. Okay, guys, so that's tonight's shows. I will see everybody tomorrow for shows. For now, Gator Wellness. Take care, folks.